Hello friends, welcome to Next Fellow, and today we shall discuss the topic familial colorectal cancers. 20 to 30% of all colon cancers have positive family history, of which 5% are named syndromes. Commonest among them is Lynch syndrome. Familial adenomatous polyposis or FAP has germline mutation in APC gene on chromosome 5. This is the same gene that is mutated in sporadic cases. Lifetime risk of colon cancer in FAP patients is almost 100%. Average age of colon cancer diagnosis in these patients is around 39 years compared to 69 years in sporadic patients. This is a total colectomy specimen showing multiple polyps, and this is colonoscopy specimen showing multiple polyps. Basing on the number of polyps, FAP is of three types. The severe FAP, which has more than 1000 polyps. The classic variety, which is the most common, seen in 90% of patients, has 100 to 1000 adenomas, and the attenuated variety, which has less than 100 polyps. There are some extra-intestinal manifestations of FAP. Duodenal adenomas are seen in 30 to 70% of FAP patients. These adenomas are mostly in ampullary and periampullary regions. Duodenal carcinoma is the second most common cause of death in these patients. Other features include desmoids, osteomas, epidermolysis, dental anomalies, papillary carcinoma thyroid, congenital hyperplasia of retinal pigment epithelium. CHRPE is seen in 60 to 85% of patients. It helps in making the diagnosis of FAP. There are two eponymous syndromes associated with FAP. Gardner syndrome is FAP with desmoid tumors, osteomas, and epidermoid inclusion cysts. In Turcot syndrome, FAP is associated with gliomas, medulloblastomas, and glioblastomas. In FAP, patients can be asymptomatic or have symptoms like bleeding, diarrhea, abdominal pain, mucus discharge, or might present with anemia, obstruction, or weight loss. Polyps start in second decade of life. So, screening in families affected with FAP start at 12 years. Later, the patient undergoes colectomy or proctocolectomy. If we do proctocolectomy, we can create an ileal pouch and do ileal pouch channel anastomosis. Or we can do colectomy and do ileorectal anastomosis. Or you can do proctocolectomy with permanent ileostomy. MYH or MUTYH gene associated polyposis is clinically similar to attenuated FAP. Has 20 or more colorectal polyps in lifetime. All other common familial conditions in colorectal cancer are autosomal dominant, but this is an autosomal recessive condition. Peutz-Jeghers syndrome is characterized by benign hamartomatous polyps. Polyps are seen mostly in small bowel, colon, stomach, and rectum. Mucocutaneous pigmentation is characteristic of Peutz-Jeghers syndrome. Dark blue to dark brown skin freckling is seen around the mouth, oral mucosa, eyes, nostrils, fingers, and perianal region. Peutz-Jeghers syndrome patients also have 90% lifetime risk of cancer. The lifetime risk of colon cancer is 40% and it is the most common cancer seen in this syndrome. These are the characteristic dark blue or brown macules seen in lips and fingers. Juvenile polyposis syndrome has a type of hamartomatous polyps called juvenile polyps. When a 5 or more juvenile polyps are seen, diagnosis of juvenile polyposis syndrome is made. Patients with JPS have 10 to 40% lifetime risk of colon cancer. Lynch syndrome or hereditary non-polyposis colorectal cancer is the most common familial syndrome, accounting for 3 to 5% of all colorectal cancers. It has mutations in DNA mismatch repair genes, leading to microsatellite instabilities. MLH1, MSH2 genes are the most common genes affected, seen in 90% of the patients. These patients have 60 to 80% risk of colorectal cancer in lifetime. These tend to occur more on the right side. Endometrial cancer is the most common extracolonic cancer with 30 to 45% lifetime risk. Other cancers seen are ovarian, gastric, small bowel, pancreatic, and urothelial cancers. Mute syndrome is a variant of Lynch syndrome, in which sebaceous adenomas and carcinomas of skin and keratocanthus are also seen. Gold standard diagnosis of Lynch syndrome is using germline sequencing of DNA mismatch repair genes. Amsterdam criteria, Bethesda guidelines are also useful in diagnosis. TAH with BSO is offered to women with Lynch syndrome along with colectomy.